Dr. Chaitra, thank you so much for being on our channel.
Thank you so much for having me.
Thank you for your time. So before we go ahead with the healthcare related questions in gynecology, I'd love to know about how you started off in this space.
Okay, so basically, I am the elder daughter of the family and not given a lot of choice after I finished my second PUC. My only two options were either you will take engineering or you will do medicine.
Okay.
At that point, I was really interested in law. I really don't know why. And luckily, things kind of fell in place and I got a good seat. And then my dad decided it has to be medicine. He wouldn't let me go outside the city.
Okay.
So then I took up medicine. And progressively, within a month of getting into that, I fell in love with what I was doing. It was just amazing how human body is created. That is what you will learn in the first year, anatomy. So getting to know more about the human body and how it is all placed and every minute things just went. I just started going with the flow. And by the time I reached my second year, I was almost certain it has to be OBG. It has to be obstetrics and gynecology for me. Yeah, by God's grace, things again went well. And then I had my entrance and took OBG.
Okay.
Lucky enough, I got it in Bangalore.
Okay.
It would have become a challenge again if my dad had to let me go out of the city. And yeah, then OBG. Progressively, as things... Nowadays, I'm sure most of y'all also will be aware that super speciality is very much required. That is when I decided I want to do a little more in the field of reproductive immunology. And that's when I started my journey as a reproductive immunologist. Predominantly dealing with high-risk pregnancy or a person who's had repeated IVF failures. That's my forte.
Okay.
That's what I work around now. So this is how things has gone. And I would say my strength right now was definitely my husband, who's pushing me through and through to do whatever I wanted. And my in-laws have been just more than supportive. There are days when used to go by them not looking at me. I used to get up early in the morning, leave to work, and late at night. So yes, it was a phase which I don't want to go through again, especially my PG period. And then I had my two daughters, and when at a phase when I felt that things were kind of dimming down, and career was always my priority. But after having a child, things change.
Okay.
So I felt things were going to come down, but my husband again pushed me up and like, no, this is required. This is what you want for yourself. And it's difficult. It's very difficult. Whatever anyone may say, you cannot, especially when you've just given birth, you have to be with the child. Going back to work, leaving the small baby, it was a roller coaster by itself. But again, I'm very thankful to my husband and in-laws for making this thing really helpful and supportive for me. And yeah, so it's just going like that.
Okay, so you come from a background of doctors, people in the medicine?
No one. I would actually be titled the first doctor in my maternal side of the family for sure.
Okay.
So dad and mom had this thing of being doctors. So they wanted to be doctors. So there were multiple number of times they used to express these things to me. And I think parents know the best. They knew what I have to do.
So your husband is also into medicine, right?
Yes.
Did that help you?
I
Did that
don't
help you
know.
take things ahead, make those decisions, tough decisions, right? As a woman, when you have children, when you do have a supportive family, lovely children, a great family, all of that is there. But do you think that was the factor that could actually push you through? Because a lot of people struggle with this.
True.
It's not easy.
What really helped me is a person being in medicine knows how it works. As I said, there are days where my husband and I don't even get to see each other. I go to bed early, he comes late, and my day starts really early. There are days that goes by where we don't even have a simple conversation with each other. Most of it is on phone, and even now, like the parent-teachers meeting is post-match. It's just that. So I don't know if I'm going to get to meet him. But what really helps is he knows how my field works. If there's an emergency for him, he goes to work in the middle of the night, no question asked. It's the same for me as well. So yes, being in medicine, he also being in the same field, more so because he's an orthopedic surgeon, it really does help.
Okay, that's lovely to know. So before we proceed ahead, could you tell me what is reproductive immunology?
Okay, in very simple words, the baby that we women carry is going to carry only half of the genetical composition similar to us. The other half comes from the husband, which is foreign to the body. And in simple terms, immunity means to recognize something which is foreign to the body and act against it. So the baby is half from the husband. So this field kind of emerged, putting this concept into view, where the baby which is carrying half of the paternal, the father's genetics, could be treated as an foreign body in the female body and could be rejected.
Okay.
Could be one of the causes for having recurrent miscarriages or even having a long-term infertility. So this is where we come into picture.
Okay.
There are multiple immunological causes, immunological diseases, which is really rampantly increasing these days. Be it, initially we used to hear about arthritis, which is the commonest immunological problem, but now we have a lot. We have autoimmune thyroiditis. We have a lot of people with lupus. So these are something where autoantibodies means there are antibodies which is acting against your own system.
Okay.
So when these antibodies are produced against your own system, there are possibilities that create certain disturbances, which is not really favorable for pregnancy.
Okay.
Having said that, there's another part of it where the uterus carries certain cells which has to support pregnancy, which is again an immune derivative. So in simple terms, again, I would say the uterus keeps the baby hidden from the maternal immune system for 9 months. When there is a disturbance in this, there could be early rejections, it could be miscarriage, or even prior to heartbeat, the baby being lost. So this is reproductive immunology, where in the immune composition of the maternal or the mother comes into play in the process of pregnancy. So that's what we do.
Okay, so we'll move on to general women health. Okay. So my first question here is, what are the common health issues that you see that women these days encounter?
Well, again, what happens is divide women based on their age mainly.
Okay.
So someone in their early 20s, I would just talk about now women as such in early 20s and 30s and 40s and so on. So predominantly what we get to see will be in 20s, most of the time it's the infection.
Okay.
Early, they would have just got married, got into the sexual life. So infections, very common. It could be urinary tract infection or genital tract infection, sexually transmitted infection. So infection is one of the commonest. Second one is malnutrition, nutrition deficiency. Lot of women with anemia, vitamin D, vitamin B12 deficiency. The next thing what comes into play, and very much on the higher side these days, is polycystic ovarian syndrome, which I'm sure most of them would have heard about. Way back when I was a PG, they would say 1 in 6 to 7 girls can have PCOS, but definitely increased now. It's very high these days. Could be because of the lifestyle, restricted physical activity, and a lot of consumption of preservative food, which is containing preservatives. Apart from that, mental health is definitely taking a toll these days. And most of which they would, again, blame it on the lifestyle.
Okay.
Apart from that, the stress. By itself, it's a big, huge chapter by itself. So predominantly in the 20s, I would say infections, problem with conception, either it's because of polycystic ovarian syndrome or other causes, obesity, lifestyle diseases like obesity, diabetes or hypertension. On the rise, thyroid. Seeing a lot of people with thyroid. Much earlier in pregnancy, thyroid was really less, but now I see it's pretty much on the higher side. Now progressing towards the 30s, where a woman is now had her child, and there again we'll have a lot of the common complaints that we would see is white discharge again. Again, infection will be there in all categories. So infection, there again, deficiency of vitamins and iron deficiency leading to anemia. Along with that, mental health taking a big challenge. Lifestyle diseases again, diabetes, hypertension. Nowadays, we're seeing a lot of women in their 30s and late 30s having even cardiac problem. Yes. I'm sure most of them have been talking about it as well. So cardiac problem again on the rise, blaming it on the lifestyle, restricted physical activity as well as the stress. So along with that, as and when the woman is progressing towards 40s, what kind of starts increasing is cancers. So it could be breast, ovarian cancer, or uterine cancer. So it becomes very essential for a woman to optimize her requirement. Now, when she's in the early 20s, it's required for her to have her annual checkup. But what has to be prioritized would be the pattern, like her cycles has to be regular, she has to be monitored for her hemoglobin and thyroid status and vitamin levels. In the 30s advanced, she should start looking at her additional parameters which she can be more prone for developing, sugars, cholesterol, BP monitoring, and progressively again start concentrating more. You need to start doing in-depth investigation, looking at how the liver is functioning, how the kidney is functioning. So as and when age progresses, the diseases kind of increases. But now age is completely not a barrier after having younger population facing cardiac problems. So at all age, most of these what you will have to cover will be deficiency in the diet, looking at the infection status, metabolic syndromes, definitely also cancers.
Are the causes for all of this really only lifestyle change?
Not really. Most of them could be carrying family history as well.
Genetic.
So yes, genetical involvement will be there. So a strong family history also has a vital role to play. But again, the question comes like, can you blame it only on the family history? No, definitely you have a role to play. Nowadays, a very famous line, I think it's like going all over the internet, is about how now 55-year-old man is getting his young son to the casualty with heart problems. Definitely the food that we are consuming, the preservatives which is added in the packed food does have a role. Stress that we are carrying around does have a role. Habits that we follow does have a role. Nowadays we've started calling having home food as diet, which is unlikely. Diet is a whole different ball game. But what happens here is that the younger generation needs to be told about multiple number of times. Most of the common causes is because of most of the diseases which is evolving now is lifestyle. But the ones which are pre-existing does have a family history linked to it.
So, genetically being a cause, genetics being a cause, right? So this is not new. Genetics being a cause could have been there even earlier. But what is the reason that it's all coming out now? Do you believe that the diseases coming out for the younger or the older ones, the number of issues have increased over the years, right? True. Genetics would have been a reason always. Maybe it's not exposed or people didn't know, so it never came out. And maybe there is more awareness now, so it's out there. So lifestyle, is there so much of a drastic change that it's come out
Definitely.
Just because of the lifestyle?
Definitely.
What is it that you would say that we should do to have a healthier life?
I wish we can do it. What all can we eliminate from our body? Initially, way back, when I sit down with my grandma, I used to have a discussion with her. How she says, I used to pluck fresh tomatoes from my own garden and I used to make curry for you all. How feasible it is for me to grow tomatoes in my garden
Not
and make?
happening nowadays.
How feasible it is to cut off the entire internet in my family? How can I do it? The radiation exposure. How am I going to cut off the radiation exposure? How am I going to cut down on the preservatives? Most of it is packed. Even if I have to make simple food, I need to get sources from outside. And obviously, anything, they will require preservatives. Now, over a period of time, they started talking about heavy metal poisoning. Heavy metals, which is present in vegetables and fruits as well. So how much of it can I cut down? As much as possible, definitely. I tell as a gynecologist, most of my patients, I would say the younger generation, suffer from polycystic ovarian syndrome, carrying a high risk of diabetes and lipid, that is cholesterol, as well as blood pressure. Young children coming with these symptoms. So when these people come, my first thing would definitely be, please make sure you don't have a family history. Your mother didn't have irregular cycles. Your grandmother had perfectly good cycles. She had 11 children. Your mother had 3 children. And here you are with infertility of more than 7 years. So definitely lifestyle has an impact on all this. So for those people, I would definitely start with gut cleansing. Gut cleansing is one of the most important things that we have to follow now.
Okay.
In which you will have to completely stop having something which is having a high content of preservatives. Along with that, I would suggest to cut down on something which increases body inflammation. Body inflammation increases when you have high content of, say, sugar, these cool drinks, sodas, chips, packed items. So these are the items which has to be avoided. Some, I also say, please avoid maida, refined sugars, colored items, deeply fried, has to be avoided. When I say such things, are like, how do you expect me to do that? In that case, I can either go out, I will start going into depression if I start telling my friends, I'm not going to come out with you, I'm not going to eat the food. So let's make it more realistic. You keep a day. For the present generation, I would suggest keep a day. Keep a day where you can have your cheat day. But the other days, be strict. You have to be strict for your own health. So that particular 45 minutes of workout for you, at least 5 to 6 times a week, very essential. The consumption of good amount of 3 to 3.5 liters of fluid for you, very essential. Cut down on the food which increases inflammation in your body. Increase the food which is good for you in the form of fruits, vegetables, something which is going to create your gut, cleanse your gut. So these are the food, and fiber intake has to be increased. So this is something I would suggest the present generation, at least to prevent the very commonly well-known diseases.
So gynecology doesn't involve just women, right? So what are the things that you see in men nowadays?
So mainly when I interact with men, it will be for infertility. Definitely on the rise. And one good thing is men are open about it now. Initially, if there is infertility, it is because of a woman. You can't carry a child. No. Men are so much... I don't know if it's because of the education or because of the awareness that the men have. It is very clear now. The men is very much okay with performing the tests on them because they think even they can play a role. Again, the diet and the lifestyle applies to both of them. Long sitting hours in front of the computer, restricted physical activity, and just consuming whatever comes over the days has an impact on the development of the sperm. So when the development of the sperm, there are various problems in this. It could be reduced count, it could be abnormal sperm development, it could be a defect in the sperm. So there are various parameters to it. So in men, we will definitely want to look into, if whenever I see my cases, it's most of the time it is for infertility, for obstetric causes. So this is what I look most of the patients do. And the infertility could be because of the husband, it could be because of the low sperm count or the defect in the head of the sperm or motility problem in the sperm. So these are the common cases that I see when it comes to a person who's carrying an XY chromosome.
Does this have anything to do with lifestyle again?
Definitely.
Okay.
It does. There are various places where we do certain blood tests and semen analysis or the sperm analysis. We find some problem, and some of them can be just fixed with a drastic shift in their physical activity and diet. It can be done. It's like PCOS. I can treat PCOS with lifestyle modification and a strict diet. I can do the same even with some of them. I can. Some of them will definitely require medical intervention to it.
Okay. And what is it that men can do to be more conscious and healthy?
Same. It is, most of it is same. The physical activity has to be inculcated in their daily routine. The diet has to be more cleansed. So most of the time when women with PCOS come, and I tell them, you have to support her. So when they both start doing it, there is a drastic improvement. And there is a high chance of even natural conception there. So most of it will be the dietary alteration and physical activity again.
Okay. So seeing the drastic reason of lifestyle being one of the causes for a lot of issues that you encounter, what is your take on early puberty and early menopause in women?
I'm so glad you came up with this. It's very difficult, when a child who's 8 years, 7 years comes to the OPD and the mother says she's just had her first cycle. That child is emotionally not even ready for this. Any girl who has her periods before 8 and a boy before 9 years, we would say it is a precocious puberty, which is early puberty, and it is on the rise here. Again, attributing, there are many studies, multiple studies, and they're going in a high number these days because of the rising cases. Initially, when it used to be, we would think that, in simple terms again, there's a part of the brain called the hypothalamus, which triggers off the pituitary, which will tell the other organs like the testes and the ovary to produce the sex hormones, and that is when the puberty hits. So any problem with the brain, it could be an infection, a tumor, or it could be other glands like the thyroid and the adrenal being involved. Commonly, these are the ones which used to be. Nowadays, the exposure again. The child's exposure to food which is having high preservatives, the child's exposure to restricted physical activity and long screen time is directly linked with early puberty. Long exposure to blue light also is linked with early puberty in girls. Also now, recently I read an article which spoke about the exposure on the internet. The content which is on the internet also having an impact on the child's brain, which is triggering off early puberty. So if you have to look at the abnormalities or pathological causes, there are a list. But nowadays, on the rise again blame it on what we are doing. Exposure to long screen time. Inevitably, when we were small, most of the things we used to do is just, favorite game for all of us was hide and seek.
True. Yeah.
And now it's difficult to get the child off the sofa, off the television, and go out and play. And multiple parents come up with those safety reasons and things like that, but required. Pampering a child by giving chocolate and pastries is definitely not the way out. We have to cut down on food which is high sugar for children. It's even causing ADHD in children, attention deficiency in children. This is because of the high sugar which is constantly triggering off the brain. So, diet for the child, very important. The content, like very high content of sugar, has to be avoided in children. Something which is deeply boiled in oil also has to be avoided. My mother-in-law and me always have an issue on milk. She's like, every day I gave your husband 1 glass of milk, you don't give the children milk. And being a gynecologist, I have my own worry. And recently one article came up on how even the cattle have been injected to produce more milk. So that was another trigger. Starting off with whatever we can cut down. When I say sugar, I mean white sugar to be cut down. White sugar and multiple things. Always for children, nowadays, my pediatrician is very strict when he says, please read the label. See what is the content of sugar. Please see the label and then give children food. Be it any of the packed items, predominantly. How can we prevent a child from having chips in a birthday party? It's impossible. A piece of cake, once in a while, obviously they're going to have it. Obviously we had it also.
True.
So once in a while is always better. But these days we see that the child is craving for it. And the tasting agents which is added is something which triggers the brain to repeatedly ask for it. So these are the things that we have to cut down. It is going to be an uphill task. It is an uphill task. As a mother, I can tell you it is definitely difficult to say no when they ask for something. And as working mothers, I think most of them will agree. Most of the time, we are not even with them.
Yes.
And the minimum amount of time we have with them, we want just love and we want to bond with them. That is where I feel we did the mistake. And that is what my husband pointed at. He's like, no, for this reason, you are feeding them things which is definitely not. Let's find alternatives. So, for children, for early puberty, has to diet. Diet would become very important for them. And yoga. Nowadays, it is proven, the studies have proven that a girl who can start doing certain asanas will definitely prevent the onset of early puberty. Yoga is de-stressing. So inevitably, when the stress level comes down, you can push puberty for a duration of time. Diet, exercise, yoga, exposure to vitamin D, sunlight. Letting the child
Not
go out
there
for
now.
at least for a cycle, walk with their grandparents, something which they can expose themselves to vitamin D. Along with that, I would also say it is very essential for us to monitor their physical activity. Has to be done. Oh, they went to school and they came back tired. No, they need physical activity. It could just be the simple one, cycling, 3 rounds of cycling around, or it could be walk with anybody. So physical activity, diet, very, very closely we have to monitor a child's diet, screen time. These are the minimal amount of things that we can start doing. Nowadays, studies also show that perfume also triggers early puberty. So that lot of things have been coming out because early puberty is due even for us. So researchers are on the go to find out what is the cause. And as far as early menopause is concerned, anything between 40 to 45 is considered early. Menopause is when the girl's body stops producing estrogen. That's her ovary stops producing estrogen. So we are, from a good age of 13, 14 years, we are used to that hormones, the peaks of hormones. The hormone stops. That is when a girl steps into menopause, wherein she doesn't have her monthly cycles. So what happens here would be when that hormone is eliminated from the body, there's a lot of changes. Why menopause has to be given so much importance is because of this. The hormone is taken off. That is a protective hormone, I would say. So when it is gone off, there's a lot of changes a girl will have to go through. Commonly, and the horrible ones are most of the bones. It goes into osteoporosis, osteopenia, wherein the calcium starts getting declined in the bones. Head to toe, there are changes. The woman will start losing hair, wrinkles starts coming, vision disturbances, teeth starts loosening, and thyroid develops, breast sagging. The risk of developing breast cancer increases, abdominal obesity of the stomach, and difficult to lose. Even if they work out, it kind of becomes challenging for them to lose the fat. Diabetes, thyroid, hypertension, recurrent urinary tract infection because the vagina and the urethra becomes dry. Sexual drive comes down, and osteoporosis. So head to toe, there are changes because of osteoporosis, because of menopause. I keep telling my patients, the way you give an importance to a girl when she starts her puberty, that importance you have to give a woman when she has her menopause. True. So nowadays it's a little early. So developing these complications a little early is again challenging. So the causes of early menopause again is commonly, the top cause will still remain our lifestyle. The diet we are consuming, our restricted physical activity, and supplementation. See, there are other causes, pathological causes, like maybe the woman underwent a removal of the uterus or the ovary for some surgical, could be because of some, maybe a cancer of the ovaries or something. But where the ovaries is well placed and a woman was having good cycles, and because of her lifestyle, this has happened, then yes, again, blame it on the lifestyle and her physical activity.
What are the absolute no-no from your side that you would recommend people to not eat in their diet for children? Not give them, like you said, no sugar, no preservatives. What are the biggest ones in this that you say, no, it's an absolute no, don't give this?
So you know what happened? I got used to this myself. It was difficult, but for me, some of the food items which I say completely no to my own children would be Maggi, Nutella, any of the health drinks which is containing high sugar, soda, any of the aerated drinks, and definitely now you get these, and because of this rise in this BTS and this K-pop coming up, a lot of them want to have these young children. I want to have some noodles, I don't even know most of those. So they want to have these sparkling water with these Maggi. Absolute no for me. Obviously, it's going to contain high preservatives. Absolutely a big no for me. Maggi, something which is high sugar. It could be bakery items. It could be pastry. Soda, drinks, health drinks, so-called health drinks, which is having high sugar. A big no-no for me.
So, does early puberty cause early menopause?
Yes.
And how are they linked?
This is a nice thing, okay. Even your grandmother carried this...
Your eggs, right?
Yes.
Yeah, I've seen this as a meme.
Yes. So now what happens is this specific amount of eggs which is there, and that has to be released. Every month when a girl has her period, she will release the oocyte or the egg. So that particular duration is there. So that amount of egg is there, and that will get over in a particular period. So if a girl is going to get her puberty, say around 14, 15 years, she'll go to a good 50, 55 years. When there is early puberty, this means that she is starting having a release of oocytes way earlier. Correct. So inevitably, the oocytes also are going to go get emptied pretty soon.
Faster.
So yes, early puberty is associated with early menopause.
Having said that, as a doctor, how hard has it been for you when you come across people who have early puberty and early sexual triggers? Like, do you have issues that you encounter because of this?
Luckily, no. I haven't personally had
Okay.
any girl who's had her early puberty come to me with this, but definitely yes. Puberty itself means where the female hormone secretion is started. Definitely its impact is going to be there. For me, the biggest challenge was this one kid who's 7 when she was got to me. This was my hit, where she was 7 and she came to me with excessive bleeding. Well-educated parents. So this is one thing. This is where she had come with excessive bleeding and her hemoglobin was quite low. Her hemoglobin was like hardly 6. So we had to get in the pediatrician and we treated her with blood transfusion. Giving hormones to a child as young as 7, that hit me emotionally. But again, profession is profession. So we went around giving her the right management. What happens when they get early puberty also is even the growth hormones kind of starts. So the height stunting also, the height reduction also kind of starts.
Okay.
So there are various parameters. When one hormone is there, the other hormones has to be evaluated. It could be the growth hormone, is the thyroid hormone, the cortisol. All these has to be looked into. As far as the sexual behavior of the child, their perception or their level of interaction with others is going to change after the cycles because she is exposed to that. But at that tender age, getting exposed to these hormones is going to be extremely confusing for a child.
True.
That there is a particular age where she has to have it. There has to be a transition, a very smooth shift of a girl to a lady. So in a child, this becomes difficult, which needs a lot of counseling, family support, professional support for her from the pediatrician and the gynecologist for her to cope up with this. Personally, I have not encountered one, but yes, I have read many articles which does show a very strong correlation between these. Their behavior towards their co-fellows will definitely change.
Do you also observe that early puberty is more predominant in the urban cities?
Yes.
Is it
Yes.
so? Okay.
Yes. Again, exposure.
Yeah.
So in the urban population, it is on the higher side.
Okay. Can you tell us a little about puberty in younger boys?
Well, again, it's not just for the girls.
Yeah.
Puberty, even for the boys, is coming a little earlier. Again, the reason stands out to be the same. The lifestyle, the dietary intake, and the restricted physical activity, lesser exposure to vitamin D. So the same thing comes and falls. So in boys, they are supposed to have their puberty much later than a girl.
Right.
So here, when a boy has his puberty, before 9, we would say it is precocious or early puberty. So he also is going to go through this whole hormonal changes, these mood changes. Physical changes will be there, be it in male or females. So even in males, the culprit would be the same almost. And prevention would just be to prevent most of it.
Okay. That's hard. Okay. What is the ideal age of puberty for girls and what is it for boys and what has it become now?
So it's way too early now.
Okay.
So I said somewhere around anything which is less than 8 in a girl and less than 9 in a boy is precocious or early.
Okay.
If you go years back or maybe in our generation, it was somewhere between 12 to 15. Now it's come much lesser. So it's somewhere around 10 to 13. And for a boy, again, less than 9 is precocious. And for them, it's little later. So usually it is from 12 to 15. So even for them, it is a little earlier now. So somewhere around 11 to 13.
Okay. For children who encounter early puberty, who are we supposed to reach out to? Is it the gynecologist or is it the pediatrician?
So when it comes to a girl who's had her early puberty, so most of them what happens is they come with bleeding. So obviously it will be a gynecologist. But I would say it's a combined effort. The girl has to be treated by a gynecologist, a pediatrician, as well as a pediatric endocrinologist. Endocrinologist is a person who's well versed with hormones. And when it comes to a boy, definitely the involvement of a pediatrician as well as the pediatric endocrinologist. So it's well there are some certain places where requirement of a urologist in a boy or a gynac may be required. But ideally, it is best that they meet their pediatrician and a pediatric endocrinologist at the first go.
Are there any resources that parents can read about to understand what is early puberty? How do you deal with children who encounter early puberty?
There are a lot of studies and well-known studies which are available.
Okay.
But something which I would say, which is a good paper, something in PubMed, nice ones which will give you beautiful insight on what is early puberty and how to manage with them, how psychologically, what is the support that they will require. Most of them will require psychological support. So some of them may even require a little bit of counseling. So all these good papers should be accepted, not just random reels. No, I would not suggest them. I would still suggest some papers which is well accepted and published in good journals would give you more information on that.
What is perimenopause?
Okay. Now, a period around menopause is called perimenopause.
Okay.
Now, it can be 2 to 3 years before, and some women can also have it up to 5 years.
Okay.
Perimenopausal symptoms is when, as I told you, in this amount of years, the girl has been exposed to that amount of hormones. Like all of us, when I have our periods, we have our own ups and downs. Suddenly, there will be a decline.
Okay.
When there is gradual decline of these hormones, the changes in a woman start. So perimenopause happens around 2 to 3 years prior to menopause, where the women start experiencing a lot of symptoms. It could be mood changes, it could be a change in her sexual behavior, it could be hot flushes, repeated urinary tract infection. So the menopause symptoms in a much milder form would be present in the perimenopause.
Does it also involve irregular periods?
Yes, very much.
Oh, okay.
So, like I told you, the eggs are there and it is getting emptied by the time you're coming towards menopause. So, during the phase of it going and getting emptied, the cycles can become anovulated. That is, no oocyte is released. So, that time she can have her irregular cycles.
So perimenopausal period also involves, even if she has had a regular cycle before that.
Yes.
So it's very much, I mean, you can identify it.
Yes.
It's not something that is out of the blue, like you don't understand.
See, most of them, some lucky women will just get up and the periods may stop. There are a bunch of them.
Okay.
But most of them will go through the ups and downs.
Okay.
It could be a period irregularity. It could be their hormonal changes leading to a lot of hot flushes. Some of them leading to excessive changes. Okay, mood changes are very much high. So for some of them, it's an easy transit. But some of them is an up and down.
Can stress cause irregularity in the cycles?
Very much. If anyone opens an article on polycystic ovarian syndrome, the first thing they would definitely want to mention is stress.
But would this be something that someone with very regular periods encounter as well?
Yes, could be.
It need not be anything to do with PCOS or PCOD? Or
Could just not necessarily.
Okay.
I was treating a bunch of these girls who were giving their 10th exam, and it is very common. The exams were coming, there was a hell lot of pressure, and there was a slight irregularity in their cycles. So, we wouldn't want to jump into conclusion and say, no, it is PCOS or it is because of thyroid imbalances. Stress by itself could be a solo individual reason why that cycles can get irregular. So sometimes a woman will say, no, my cycles have been on dot and only this month it's been like this. And you dig a little more into the history and they will say, no, I just had my housewarming ceremony and I was a little stressed out. It's okay. Give a break. See how your cycles are next 2 months. You do not have to jump into and, conclude major things at all. Stress by itself plays a vital role. And after 10, I see most of them didn't require any treatment. Some of them came back to me after they got their result just to say, hi, we are all perfectly good that we scored extremely well.
Oh, nice.
Most of them will not require any treatment.
Okay.
And at that point, all that what we can do would be calm them. That is where yoga comes into play.
Okay.
Parent support kind of really plays a vital role. So yes, for women, stress does play a vital role.
What kind of symptoms do boys see when they are stressed? Boys, men, in this phase, like for women, probably it's irregularity in their periods. What is it that you see equivalent to that in men?
Mood changes.
Okay.
Is something I would say. See, for men again, their lifestyle really impacts. The habits really impacts. So for them, they're as important as it is for a woman to have her annual, that is yearly once blood checkup. It is as important for a man also to do the same. And this is because some of the diseases are hidden and it can just pop up in some blood test. Even before a person is diabetic, the person may be diabetic for the last 4 to 5 years also. So for men, most common changes, different conditions. Some of them will start just losing weight. Some of them may start gaining weight. Some of them may start having abdominal obesity. So various kind of symptomatic changes needs to be observed. Some of them will start losing hair. So weakness in the lower limb or back. So depends on which organ is being affected.
What, according to you, is the reason for rise in cancer nowadays, the recent times?
First, Noshiba, I would love to say I wish it is because of the early detection.
Okay.
We have beautiful tests.
That's a
right
good
now.
thing, right? So, yeah.
That I just want to start off with something which is really
Absolutely.
good. It is because we can detect cancer much early. Now, example, just talk about cancer cervix. Cervix is the mouth of the uterus, and it's the commonest genital tract cancer. This is caused by a particular virus called the human papilloma virus. So what happens is not all cancers are caused by viruses, but this particularly is caused by this virus called HPV or the human papilloma virus. The changes that this virus creates on the cervix can be detected way before the cancer actually sets in. So we have this beautiful test called the pap smear, or now more advanced form is a liquid-based cytology, wherein we can also estimate if that virus, that particular pathological virus is present, which can cause the cancer. So these screening methods have definitely increased the rate of diagnosis for us. And that's why we pick up these changes much earlier, start treating them even before they step or develop these kind of cancers. So for the breast, it could be, we strictly tell women, please start doing self-breast examination every month. It can be the first of every month or the first day of your periods. Do an examination yourself. After 40, we start telling them to start doing mammogram. So in that case, we have early detection, which could be the reason why we are finding out more. Awareness. People have really got awareness. Now, I would like to thank the social media for this.
True.
So people have really got into diagnosing. They know about it. Now, I have white discharge. I should become alarmed. I have to go meet a gynaec. I have to see if the things are good. I'm having little pain in the breast. I have to go meet a surgeon to see if there's any problem. So apart from awareness, a good part, there is a definite increase in the cancers. Like the colon cancer is also on the rise because of the dietary habits that we're following, high caloric diet, and high food which is having high inflammation. So colon cancer because of habits, smoking, lung cancer again, also because the liver cancer also. So cancer are on the rise again because of what we are consuming. There's a beautiful article which was recently written by a study which was done in Harvard, which said what you're eating today will tell us how you are going to be tomorrow, or how your retired life is going to be. So true. So the food that we are consuming today will tell us how much of the hospital visits are we going to be having later on. So this again has a very deep impact, and this could be one of the reasons why cancers are on the rise.
How effective are these cancer vaccines that have come up now? You could speak of the specific ones as well if you think that is effective.
The commonest and the very well-known one is a human papilloma virus. And after the budgeting on 2024, when they told the girls can be given the particular vaccine free of cost. Now, this particular vaccine acts against
This vaccine is the
human papilloma virus vaccine. Yes,
okay.
It's called the HPV vaccine.
Okay.
This not just prevents the cervical cancer, anal cancer, also it can be given even for men, even for boys.
Okay.
So ideally it has to be given before a girl starts becoming sexually active, before the first exposure of sexual activity. So after 9 completed years is where we give this HPV vaccine. Definitely effective. It targets the high risk of these HPV viruses. I would suggest every girl should go through and get her vaccine for sure.
So the young ones get covered, right?
Yes.
What about the older
adults? The previously they said that we have to do a test. We have to see if the woman is already infected with the virus and then only. That's why I told you about this screening method of liquid-based cytology, wherein I can also detect if the virus is present.
Okay.
If the virus is not present, then yes, definitely used to give them. But now the Foxy's guidelines says we do not have to do the test, and even a woman who's sexually active can be given the vaccine to prevent the development of a cancer tomorrow.
Okay. So the breast cancer, cervical cancer, anal cancer, all of this does that come under the radar of a gynecologist?
Anything to do with the genital tract, that is, if it is the cervical cancer, uterine, ovarian cancer, vaginal cancer, vulval cancer, it comes under the radar of a gynae. Even in us, there is a specialty which is called the gynaecologist. So they deal with it. When it comes to anal, it is more of the gastroenterology department.
Okay.
And when it comes to the breast, we have the surgeons who are specialized for oncology or surgical management. If required, surgical oncologist would be a better option.
So who is the person that we need to go to first?
Most of the women will come to a gynae.
And is that is the right way to go about it? Okay.
When they come to a gynae, because most of them are very well known. If they come back, they'll either you would have delivered them or you've related to one of them. And it's more friendly. The good thing about a gynae is that they have dealt with them for 9+ months. Okay. So they're very well versed with each other. So they feel more secure, more trusted when they come to a gynae. But yes, the gynae will enroute them to a surgeon who will give them the next management.
Okay.
So when it comes to surgery for the breast, the surgical oncologist will be performing the surgery.
Okay. How often should a woman visit a gynecologist? Like, when are those? It's not just symptomatic, and I'm not talking only about cancer or nothing specific, but regular checkups, regular health checkups, and how often should somebody visit a gynae to keep good health?
See, very frankly, post 40, I would say annually.
Okay.
Make sure you meet your gynae. Okay. Annually, once you have to meet her. 3 years once you have to do your pap smear.
Okay.
Becomes very essential.
Okay.
Now, before that it varies. Now, depends on how is her health. At least once in 2 to 3 years, you make sure you visit your gynae.
Okay.
Get a routine just checkup. Anyways, once a girl is sexually active, you have to get your pap smear once in 3 years. So you will meet her. Do not wait for the symptoms to come. As I told you, most of the diseases do not have symptoms. So they can be pre-existing in you even without giving you any warning signs. So make sure you meet your doctor once in 2 to 3 years, just to make sure things are going good. When it is in the preventive phase or when it is just initiating, so we can manage it without a lot of medical intervention.
Okay. What, according to you, is the reason for the rise in infertility? Not just men, but women as well.
It is on the rise. On the rise. Infertility is crazy high these days.
Okay.
Now, infertility is where they can't conceive.
Right.
Various factors comes into play. Is it the problem? Is it with the sperm or is it with the egg? Is it the embryo which is not able to develop properly? Is it the embryo which is not able to get attached to the uterine line properly? Various reasons. Now, it is on the rise because almost everything is kind of increased. Infection is increased. Infections, genital tract, sexually transmitted infection is really on the rise. It by alone can be a cause of infertility. So some of the infections causes tubal blockage. That could be one of the causes for infertility. Exposure to some certain amount of toxins can cause problem in the sperm and the ovaries. Okay. Exposure to radiation can cause abnormalities of the sperm and the ovaries. So there are multiple factors which is coming into play. A person who's having diabetes for a long time and uncontrolled, he can have erectile dysfunction. A girl who's having PCOS can have irregular production, irregular cycles because of a wrong pattern of secretion, release of these eggs. So again, it revolves around various causes. And you come down to it, it'll all come to a phase where our lifestyle is definitely not that healthy. And one other thing that I have observed is delaying the pregnancy. I've seen that women are delaying pregnancy. Yes, definitely career has to be given importance. But there are a list of tests that you can do. You can be sure, you can know how the eggs and sperm is in your body and plan accordingly. Now there are beautiful methods. There are some women who want to postpone their pregnancy to 35, 40, wherein you can do freezing of the eggs.
Yeah.
So make sure you do your checkups. If you're annually doing your checkup and you don't have any problem, then okay. But it's better we are aware of our body at that point. This, you said we need to have our routine checkups. Very essential, because if there is diabetes down the lane, that can have an impact on fertility. Cholesterol, that can have an impact on fertility. Thyroid definitely has an impact on fertility. So increase in these conditions are going to play a role in infertility.
Okay. So, having said the lifestyle being one of the major reasons for a rise in infertility, and whatever other reasons are there, we will have to go into what can help infertility, right? So, you have a lot of medical advancements now, a lot of things that happen. IVF probably is one of the things. What are the solutions that are available? What is it that somebody can do if they encounter infertility?
The first and foremost thing would be to find the cause.
Okay.
If it's a tubal cause, if now we have a uterus, we have 2 tubes in ovaries. If the tube is blocked or it is non-functional, so however good her egg is, however good the sperm is, the pathway is blocked.
Okay.
So that may require surgical intervention.
Okay.
Now talking about the ovaries, if the ovaries is of poor quality or the egg is not produced, then we may have to go for an IVF, and in that also they may suggest for a donor egg. Sperm. Is the sperm count low? If the sperm count is low and if there is motility problem in the sperm, they would suggest to do IUI, wherein they take the sperm outside and inject it into the uterus at the right time when the egg is rupturing. Now, coming to the uterus, if there is a problem in the uterine pattern, it could be a fibroid or adenomyosis, treat it again. If required, surgical management of the same.
Okay.
Other causes will be thyroid, diabetes. Those has to be well controlled. So, we are going to manage the fertility problem properly.
Okay.
So, my suggestion would be find the cause. Find the cause, treat the cause, and then we advance to the next level. Ideally, how it goes, you go to a gynaec, you find that there's a problem, there's PCOS. She tries to give you additional medications, try to reverse PCOS, and then she will give you some more tablets to help in production of the eggs, and she may also suggest IUI. Step by step. None of the gynaecs will say at once, please do this. It will always be very, very, very stepwise we go. Do this, start with medications, then I will see your egg is producing well, I will do an IUI. IUI is not working. Maybe I'll want to put a camera and look into your uterus. Is there any problem in the uterine cavity? Next, I would suggest, maybe we always have an option of IVF. So that's how the treatment for infertility should go.
Okay. Because you're a doctor, I have a question. Why is IVF so expensive?
Because the technology that goes into it is a lot, and IVF by itself, the instruments that we use, the agents that we use, the media that we use are all, it's by itself very expensive. A person who would have gone through IVF will also know the medications that they are taking also is pretty expensive. It has to be done in an all sterile room. It's not a one-day procedure. They will start from day 1. So her eggs will be monitored, the eggs will be taken out, and that is a single cell. To preserve it, to do genetical analysis on that, to form an embryo, give it an environment in which it can grow. A lot goes into it. So the process is expensive by itself.
So how does somebody handle when there is a failed IVF?
Okay.
Mentally, financially, physically, what's your take on that?
That is, again, as I told you, that's my forte. Now, whenever a patient comes to a reproductive, it comes to my OPD, I most of them have already given up hopes. Their last line, this is the last time I'm going to try. I don't want to go through this again. I cannot go through this again. Just like an example where this girl is like, it's embedded in my, I think my memory, even my grey matter very, 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 very deeply. She had 3 losses. It was not IVF, but it was losses. It was pregnancy loss by itself. And when she came to me, she said, ma'am, I will not be able to put another baby to grave. I can't. And there were days where I think she was a part of my prayers every day. Yes, medically, whatever is required, we will do. Luckily, we found a cause. Luckily, we had a healthy pregnancy and we delivered her in 8.5 months. But that is one patient who is just so strongly embedded into me and gives me the zeal to do this more. Now, when I say this, when a person comes with IVF, see, the baby doesn't have to be, even if the woman is going to lose a child at 3 months, it's equal to losing it at
Of
whatever.
course.
She's a mother, she would have
Yeah.
gone through this. IVF failure, on the other hand, is where everything is monitored. The right time, the lining is come, the egg is done, the embryo is ready, and the embryo has to be transferred. So ideally, when the doctor speaks to them, they're given complete knowledge on this could happen. This is the lining status, this is your egg quality and the sperm quality, this is the embryo, I'm going to put it in, this is the percentage of success or failure. So beautifully in IVF sectors, they are counseled well. So they are mentally prepared for it.
Okay.
But repeatedly having an IVF failure really takes a toll, not just financially, mentally. People go to any extent to have a child. And an IVF failure seems to be like a dead end. After an IVF, they're like, there's nothing more that, madam, there's nothing left. I have done everything. I gave up my career. I gave up so much financially and still I am left with zero. No. Medical science is advancing really soon. And nowadays, the causes we didn't know 5 years back, we have the causes. And that is what we are working on right now. So when there's an IVF failure, again, there is a way wherein we look into what went wrong. What was the problem? Was the receptivity not present in the uterus? Was the embryo quality not good? Was the uterus lining not ready, or the cellular composition uterus was not ready for it to receive the embryo? So we go again. So some of them who've had one IVF failure, in the second, third IVF, they may succeed also. Finding the cause and managing them is always the first thing that I personally feel should be done.
Okay. So there is always a hope if you find the cause and treat it right. So it's not really a dead end. That's what you mean?
I would definitely say that. As a gynaec, I would never give up on this line.
What's
There is
been
a
your
way out.
most memorable encounter so far in the number of experiences that you've had?
Well, as I told you, this one, she's just there through and through for me. This is one girl who's, I think I usually do not talk about something. I'm a big follower of Mahadev. So any of the temples I go, I used to kind of start praying for her as well. And I don't know, I somehow feel it kind of worked. But if I have to be asked about something, one other case, which is even now gives me, goosebumps, would be this one girl who is 19 years, who was got to me from Tumkur. Way back then, I was working in a government sector. So she was got to me in married 1 year back. She's conceived naturally, and she was got to the hospital with excessive bleeding. She's bleeding a lot. She was unconscious when she came to the hospital, and she came in an auto very clearly. The entire floor was drenched. It was only blood. Pulse was really low. We put her on the trolley. We rushed her to the OT. Doing an examination, we find a lot of clots in the vagina. Doing a scan, a little bit digging into the history, we found out that she was pregnant, and she had a miscarriage. It was not planned, nothing. It was spontaneously she had an abortion. The doctor had suggested to go ahead and do a DNC because the medical termination failed, which they did not agree for. She was taken back home. She said, no, anyways, it's gone, it'll come out. This girl went into shock. She developed infection. Whatever products was there remained in the uterus. It had got infected, and she was bleeding profusely. Even now, if I close my eyes, Shiva, I can see that. It was that amount. It was like an open tap. She was bleeding that much. The amount of blood that we have pumped into her, and she stayed in the hospital for close to 16 days. Very clearly, I remember. Even on the last day when she was going, she gave me a lipstick and went. So that girl is on my mind, and this is mainly because of ignorance. This happened because of ignorance. That girl didn't have to go through that. She is just there. She had long, thick hair, and when she was on the OT table and we were operating on her and we were doing the DNC, we didn't know. I'm still telling you, I don't know if she was going to make it. My only thing was, I have to stop the bleeding, give her as much as possible so I can save this girl. This girl is 19 years old. I cannot afford to lose her now. So This is one thing that I would tell girls: don't ignore. If there is a medical method and the doctor suggested something,
What
don't.
actually had happened?
It was an incomplete abortion.
And she was
She-
not aware of it.
She was aware of it. They had given her tablets. The doctor suggested we will do a DNC, a dilatation and
that's
curettage,
what
which
is
the
the-
family didn't consent for.
Oh God. Okay.
So she was taken back home. And that is when she came back in the state of sepsis and shock. The products had got infected. She was in shock. But that night, my anesthetist, my ICU team, and my OT staff did a fantastic job. In IU.
Yeah, I mean, it gives me goosebumps to listen to it. Wonderful. This actually shows how much of an awareness is required, right? For people to understand where do you draw that line of self-treating, making your own decisions, and where you have to stand for yourself and go for what you have to do, right? Okay. Had any case of where it was a failed case, whatever you've encountered, have you managed to solve all of it
Not
properly?
really, Emma. See, as I told you, this as an obstetrician, touch wood, God's been favorable. But when it comes to infertility, yes, I have 3 patients who are on list who have not conceived even today, and they have been persistent. They have been so persistent. I'm still hoping things will go good. We can't start the treatment with the earliest. They can't ask me to do the last thing first.
Okay.
So I have to go step by step. I have to give them HCQs. I have to give them Azeron. I have to go very much mild, because when I'm treating a person with immunomodulators, things can go up and down. The medications have a toxic impact on them. So I can't just directly go and give that last drug and say, oh, I'm sorry, it didn't happen. So I am still in the process. These 3 girls, one of which she had early features of uterine cancer, and she still wants to carry her own child. There's another couple who's 40 and 42 who did not agree for a donor. They wanted their self egg, and we're still working on that. There's another patient who is 10 losses, and the 11th also she lost. So these 3 will be a challenge, but hopefully.
I hope that works in your favor soon. Okay. On a wrap, what would you like to tell women out there with respect to reproductive health in general?
The dearest of the dearest women, I would like to tell you all, give priority to your health. I understand you're a mother, you're a wife, but you need to prioritize yourself for one reason, because the entire family revolves around you. As a healthcare professional, I would suggest do your annual health checkup. If there are symptoms, any symptoms, minute symptoms, make sure you visit your healthcare professional, be it whoever whom you trust in. Make sure you sort it out. This becomes very, very important for you. Small things can turn out to be something which we are unaware of. So make sure that you have your routine checkups, and any minute things, you make sure you do visit your doctor.
Thank you for your time. And I have one last question. If there's anyone out there who want to reach out to you, how can they do that?
Okay,
You have a hospital of your own, if you would want to put out about that as well.
So I am available in a hospital called CANS Multi-Speciality Hospital, which is in Vidyaranyapura. It's a 100-bed hospital. It's a small dream that my husband, I, and my 2 other friends, Dr. Abhilash and Dr. Shravya, started. We started our small journey, and yes, I'm available throughout the day in that particular place. Also available in a hospital called Chandre, which is an immunology center which deals with research as well in the afternoons.
Okay. Thank you so much for your time.
Thank you.
It was wonderful. A lot of informative things for me. I'm sure for a lot of people it's going to be great. Thank you so much for your time. I know you took out a lot of time from your busy schedule when you came in today. Thank you.